Welcome to AM Best Audio.
Danny Aronson is the co-founder and chief executive officer of Tuned, a digital hearing health innovator on a mission to reposition hearing care from reactive, out-of-pocket expenses to a proactive, preventative pillar within the employer-sponsored benefit portfolios. Aronson and his team are advocating for hearing health to become a standard employer benefit, challenging the status quo of traditional health benefits design and helping organizations close critical gaps in care access for employees and their families. He joins us now. Danny, so glad to speak with you today.
You too, John. Thank you. Excited to be here, and thanks for the opportunity to share what Tuned has been up to.
So, Danny, how do you define the connection between hearing health and organizational performance, particularly in terms of communication, productivity, and workplace safety?
It's a great question. I think, it's kind of a commonsensical thing when you think about, the key requisites for any employee that works in a company. I always see these on like job applications, right? It's like great communication skills, where the ability to hear is foundational to the ability to communicate and the ability to hear well. And for some reason, that's been kind of degraded and not something that we look at or really care about that much. And like you said in your great introduction, we've been very reactive looking at hearing. Basically, we sometimes maybe get a hearing test when we're in elementary school, and then when you're 75. So what happens during those 60, 70 years? Obviously, there's an impact on your hearing. The ability to communicate and to use your hearing to in a productive way within a work setting or a family setting is obviously essential. And it's been neglected and not focused on for too long. And I think Tuned is really offering a new way to look and think about it.
So, along those lines, why has this connection been overlooked in traditional benefit strategies for so long?
I think it has to do with the history of the hearing aid industry and the kind of the way that it's designed. If you think about dental, like in the 50s and 60s, it's a little bit like that when it was a very reactive business until kind of the 60s and 70s. They started going in and saying, it's better if you see a dentist twice a year, and kind of, try and proactively reduce, dental issues than having to deal with you if you have any type of like serious dental issues. It's obviously more expensive and more complex. Traditionally, hearing, especially in this country, has been owned by 5 large hearing aid manufacturers. 4 of them, by the way, are foreign companies, Scandinavian, one is in Switzerland, and there's one American company. And for the past 40 years, the hearing aid manufacturers are basically own hearing. They own over 50% of all the clinics in this country. They're not private clinics. They are owned by the manufacturers. And everything around hearing, think about what you've ever heard about hearing. It's always around, grandpa's hearing aids and, somebody needs hearing aids. And it's all kind of focused around hearing aids, which is great for the hearing aid companies. But what that has done is like completely skewed this critical area of human health, which is the ability to hear, around a particular product or a particular device for people with moderate to severe hearing loss. Now, what Tuned is bringing to the table, because we are the largest network of audiologists, of hearing specialists in the country, we focus on all aspects of hearing health. And we have like 4 foundational aspects. One is obviously treating anything that has to do with hearing health, but even more importantly, prevention. We now have over 50 million people in the US who have some sort of hearing issue. And we have what we call the headphone generation. These are people in their 20s and 30s who use AirPods or headphones for 5, 6, 7, 8, 10 hours a day, every single day. Now, you don't need to be a professor of audiology to understand that is going to negatively impact your hearing. But there's basically nothing out there except for, here's a coupon for a hearing aid. What Tuned is bringing is a very kind of holistic, comprehensive way of thinking about hearing, which says, let's focus on prevention. Let's focus on all forms of hearing loss. Let's focus on tinnitus. Tinnitus is this kind of ringing in the ear, which a lot of people have. Let's focus on balance issues. Your balance mechanism in your body is in your inner ear. Even if you have mild to moderate hearing loss, you are susceptible, or you're 3 times as likely to have a slip and fall. And that obviously is very interesting for insurance companies. It's very interesting for employers. So that's what I mean from taking the focus traditionally on using the employee benefit space as a distribution channel for a coupon for hearing aids owned by the hearing aid companies to a comprehensive, preventative digital platform that looks at hearing from prevention to intervention.
Your recent announcement positions 2026 as a turning point for hearing health becoming a baseline employer benefit. So, Danny, what gives you confidence that this shift can happen industry-wide within this time frame?
First of all, I'm the CEO of a startup, and I'm confident by nature and optimistic. But I've been around. The company has been around for over 5 years now. We've raised a significant amount of funds. 2025 was a seminal year for Tune. For the first time, we've passed over 100,000 members. We now serve hundreds of companies, from very small ones to companies with, I think our biggest one is like 11,000 members. We are the largest online network of audiologists in the United States. Just in terms of sheer volume of consultations that we do on a monthly basis, we're probably one of the largest audiology clinics in the US, if not in the world. And I think, a lot of times startups are like, it's an overnight success, 5 years in the making. And that's where I feel Tuned is going into 2026. We've turned a corner, and we're seeing, in terms of our relationships and partnerships with very large insurance firms like Colonial Life, like Unum, like Emeritus, and others coming through our pipeline, that this is really becoming a foundational benefit, and people understand that doing an once a year a 10-minute screening online to make sure that your hearing is fine, and if you have any issues, here's a really easy way to deal with it, is better than just neglecting it.
Customize your data experience. BestLink now offers an interactive company dashboard that provides company-level intelligence in a fast, user-friendly interface featuring interactive tables, charts, and Sparkline performance histories. Customize the dashboard tiles to prioritize the insurer ratings, data, and analytics that best support your workflow. AM Best. Our insight, your advantage.
Danny, many employers have historically focused their benefits investments on physical health screenings or mental health resources. What evidence or data demonstrates that hearing health deserves a seat at the same strategic table?
Yeah, I think, again, there's a lot of statistical data here that I think will really surprise people. As I said, over 50 million people in the US, and this is a conservative estimate, have some form of hearing issue. Notice that I don't say that they have hearing loss. Hearing loss is a particular type of hearing issue. And again, only people with severe hearing loss are a good fit for hearing aids. But there's a whole spectrum of that. As I said, tinnitus, vestibular issues. Hearing loss is the third most common chronic physical condition. Your chances of having a debilitating slip and fall rise exponentially if you have untreated hearing loss. Johns Hopkins did a longitudinal study that showed that people with untreated hearing loss typically cost payers around $2,500 a year more, because they spend more time in hospital, they fall more, they have more health issues. It's connected to other comorbidities. So it's a very significant issue that has just been kind of neglected. It's a white space. And just like we have dental and just like we have vision, we need to take care of our hearing.
Are there barriers that employers and benefits leaders face when trying to integrate hearing health into standard benefit offerings?
Again, I think traditionally the only thing that was on the table, like the only thing you could get from the menu was, oh, okay, here's a 20% discount on a $6,000 device from a traditional legacy hearing aid coupon company. Shockingly, hearing is not covered by insurance. It's not even covered by Medicare. Now, 2 out of 3 people over the age of 65 have significant hearing issues, and yet that's still not covered by Medicare. There are no traditional benefits for hearing in the way that Tuned is kind of advocating for. So I think the challenge or the opportunity for an employer is to look at this and say, well, here's something that I can actually do. I know costs are rising across major medical and so on and so forth. Here's something that I can do, which is very, very affordable, and Tuned is extremely affordable. It's about a quarter of the cost annually of what dental costs on a monthly basis. And here's something that I can significantly improve the quality of life of my employees. One thing I do want to mention, which is a new thing that we're introducing in 2026, and this is coming from my conversations, and I pitch this to HR people and benefits people all the time. The first thing that comes up in these conversations is my mom, my dad, my uncle, somebody in the family has a significant hearing issue. There's nothing they can do for them. So for the first time, Tuned is now offering the ability to add your parents, the employees' parents, as beneficiaries of a voluntary benefit that we are offering, which would give them significant discounts on hearing aids. And if you're part of the sandwich generation, as I am, you know that that is a significant issue. And again, nothing like this has ever been offered before.
So, as the employer benefits landscape evolves, how do you see preventative hearing care intersecting with broader trends in personalized health?
I think what we are championing is something which we call whole head health. And the idea is just like you have dental vision, it's going to be dental vision hearing. Again, it is a critical sense. You want to be able to hear both in terms of your work, but in terms of your life, and your family and your friends. Up until now, we did not have the ability, or up till the last 5 years, we didn't have the ability to do very high quality screenings online. We now have the ability. We now have over-the-counter hearing aid devices like the Apple AirPods Pro 2 and 3, which are FDA approved over-the-counter hearing aids. Tuned is working with Nuance Audio, which is hearing glasses from Luxottica, which is a fantastic product, which is great for people who have a hearing issue but are not ready to invest in a hearing aid or admit to themselves that they need a hearing aid. And there are many people like that. And this is just a pair of prescription glasses that have microphones in them. I use them all the time. They're a fantastic product. None of this existed 5 years ago. So we now have a lot more opportunities, a lot more things that we can do to help people. And I think it needs to be a totally standard benefit, just like dental vision, just dental vision hearing for every employee in the U.S.
So, looking beyond the workplace, Danny, what role do you see employer-sponsored hearing benefits that will play in shaping public health outcomes or influencing policy around hearing care access and preventative wellness services?
100%. I think, in one of the things that we always say about Tuned is that we're giving ears a voice, and hearing is critically important. By the way, there is a I'm sure you've seen this, but there's a lot of research about the connection between untreated hearing loss and cognitive decline. There's a connection between untreated hearing loss and rising healthcare costs. Hearing needs a place at the table, and it is a foundational benefit. One of the things that I keep seeing, and again, I know people love their pets and stuff like that, but there are literally more dogs in this country with insurance than people who actually have access to hearing health. That just doesn't make sense. And it's time to correct it. And Tuned is offering a very easy, simple digital platform at an incredibly affordable rate to make hearing a foundational benefit, and hopefully help people address their hearing issues before they actually need hearing aids or before they need more drastic interventions.
Danny, thank you so much for taking the time to speak with us today.
Thank you so much, John. I appreciate it.
That was Danny Aronson, the co-founder and chief executive officer of Tuned. And I'm John Weber for AM Best Audio. Looking to get the full attention of the insurance industry? We have the platforms that will do just that. Whether it be AM Best TV, AM Best Audio, Best Review Magazine, or Best Day. Find out more by calling AM Best Advertising Sales at 908-439-2200, extension 5399, and have a great day.